Well, before we came on air, I spoke to the Health Secretary, Matt Hancock, and I began by asking him how he felt seeing the vaccine being rolled out.
Well, it was really emotional. I mean, we've been working on this for so long, and it's not just, of course, for everybody who's been vaccinated today, and I'm here at Milton Keynes, and I've met some of the people who've been vaccinated, and but it's actually for all of us, because this vaccine shows the route out of the pandemic.
How do you now build confidence in the vaccine amongst the general public? Because the WHO recommends using trusted messengers to do that. Who might those trusted messengers be, do you think?
I think the best people to make this case are the clinicians. You know, the jab is safe. It wouldn't be approved by the MHRA if it wasn't safe.
So not politicians or the
also
Queen?
People listening. Well, of course, we have a role as politicians, having led the programme. And
would it help for the Queen to be pictured having the vaccine?
Well, Her Majesty has said that she will be vaccinated, and she'll let everybody know when that's happened. So, you know, all nonagenarians and octogenarians are going to be offered the vaccine. And one of the things I love is the fact that the principle of the NHS, the founding principle, is that we should treat people according to clinical need, not ability to pay. And that goes for everybody in this country. It goes for Her Majesty, and it goes for everybody else.
Are you personally worried, as Health Secretary, that lack of trust in the government will lead to many, many people saying, no, they don't want the vaccine?
Well, the good news is we have a majority, according to most opinion surveys, of people who are actively enthusiastic, and around 3/4 who say that they plan to get vaccinated. And obviously, we hope to continue to increase that over time. But the good news is, if you look at international surveys, we're actually up there amongst the highest, which is good. Now, I want to do the work over the coming weeks to see that number increase, to give people confidence that they should come forward, that it's the right thing for them, it's the right thing for their communities. So, you know, we've still got work to do on that.
Given there will be fewer doses of the vaccine, and the Oxford vaccine, if it gets approved as well, fewer than expected by the end of the year, do you think people in their 40s and 50s should expect to wait possibly into the summer to get this?
No, I hope that we can get through the programme sooner than that. We aim to reach all of those who are vulnerable by the spring.
But all vulnerable people by the spring, that implies people who aren't necessarily vulnerable, healthy 40, 50-somethings, not until the summer, potentially.
When we've come to the priority and taken the clinical advice on who to prioritise, age is the dominant factor in that prioritisation. And as we know, people of, you know, in our 40s, like you and me, are much, much less likely to have serious incidents of the disease or die of coronavirus than those who are elderly. And so that means that we have got this relatively straightforward prioritisation, which is essentially based on age, and then with other clinical vulnerabilities and, of course, health and social care workers.
Clearly, the vaccination programme will not be rolled out in time to prevent there being lots of restrictions for the foreseeable future. You've made that clear. We've only just emerged from the second national lockdown in England, and yet the virus is growing in Essex, Kent, London. Should those areas expect to be put into Tier 3 before Christmas, do you think?
Well, we'll take these decisions on the 16th of December. You know, the tiered system is precisely there so that when areas have got a problem, we can put them into a higher tier and work with people to get the virus under control.
We haven't had a chance to speak to you since our investigation in May about the depletion of the PPE stockpile. So now that the NAO has reported on this very area, do you regret overseeing the depletion of that stockpile to the point where you had to spend £10 billion extra to secure enough of it?
No, I'm absolutely proud of the work that the team did and that I was part of, to make sure that there was never a point at which we ran out of PPE as a country.
You had to spend £10 billion
we needed to buy
extra
from around the world. Prices went up around the world because there was this massive increase in global demand for PPE, and that's what the National Audit Office report found.
But the National Audit Office also reported that companies recommended by MPs were given priority PPE contracts. On a separate note, was it right that an acquaintance of yours, Alex Bourne, got a £30 million deal to supply tens of millions of vials for COVID testing, despite having no experience in that area whatsoever?
Well, the thing about that contract, as with all the others, is that it wasn't signed by me and it went through the proper process. And this was a massive national effort, Kathy. That was the thing. And we were absolutely throwing everything at it to make sure that people in hospitals like this one had PPE all the time so they could protect themselves. And I don't regret absolutely driving that as hard as I possibly could, and we did it properly and appropriately, which the National Audit Office sets out in the report, according to the rules, quite rightly.
You say you had no regrets about those contracts. Looking back over the last year, though, it's been an incredibly traumatic year for so many people. Do you have regrets about any decisions that the government took?
Oh, yes, absolutely. Of course, we learned a huge amount all the way through it. I've talked before about how the rules at the start were interpreted that people shouldn't go to the funerals of their spouses, and I thought it was terrible, and so we changed those. And absolutely, we learned about the fact that this virus spreads from people who don't have symptoms, which makes it so hard to control. All the way through, my team and I have tried to do the best we possibly can with the information available to us, often without enough information available by the nature of this being a completely unprecedented event and an unprecedented disease that didn't exist a year ago. So that's been the approach that we've tried to take, and I'm just absolutely delighted today that we've got to the day that we can finally roll out a vaccine, which is the start of the end.
Matt Hancock, thanks very much.
Well, now, the AstraZeneca Oxford University vaccine has been shown to be safe and effective in clinical trials. It is now waiting to be approved so that it can be rolled out among the population. The government has pre-ordered 100 million doses, which will be ready to go. Earlier, I spoke to Professor Sarah Gilbert, who is Professor of Vaccinology at the University of Oxford and head of the team that's developed the vaccine. And I asked her what the now peer-reviewed data shows.
We see very high efficacy of this vaccine, which is also shown to be safe. We saw different measures of efficacy in different groups in the trial. Those who received a half dose first, followed by a full dose, had a higher efficacy than those who had 2 full doses. But the other thing that we found is that from anybody who had even a single dose of the vaccine, 21 days after vaccination, there were no cases of hospitalization with COVID and no severe COVID cases. And that's a really important finding from a public health point of view, because if vaccines can prevent people going to hospital with COVID, then we will have a major impact on the ability of the health service to respond to this disease.
Now, obviously, the emphasis today, given what we're experiencing as people are having their first vaccinations, is that, of course, it's very old people that are being targeted with the vaccination. How effective is your vaccine when it comes to that age group?
We haven't been able to analyse efficacy in people over the age of 55 as yet, because the people in that age group were vaccinated later in the trial and haven't accrued enough cases to be able to analyse the efficacy. But what we do have is a lot of people who are vaccinated now and will be included in the next analysis. And we've also been able to report previously that the immune response to vaccination, and particularly the neutralizing antibodies, which we think are the part of the immune response that's most important for protecting against COVID, those are not decreased in older people compared to younger people. There was no decline in the response to vaccination across the different age groups. So we have very good grounds for hope that we will see as high efficacy in older people as we do in younger people, but we are waiting to be able to collect enough data to analyse that.
What is so extraordinary and perhaps exciting is that different groups of scientists have arrived at different answers.
This is really important because we want multiple ways of making vaccines so that we can get the most number of doses made to vaccinate the whole world. If we're all trying to rely on the same technology, we might run into bottlenecks with supply problems. So having lots of different technologies working, but achieving the same result of safe and effective vaccines is really important. And I'm so grateful to all the volunteers who've come forward and taken part in our clinical trials and other people's clinical trials as well. And that's what we need to be able to develop these vaccines. And I would like to give a huge vote of thanks to anybody who's taken part in a COVID vaccine trial in this year.
Professor Sarah Gilbert, thank you very much indeed for talking to us.
Thank you.
And in the latest official figures, there have been another 12,282 new coronavirus cases in the last 24 hours. A further 616 deaths have been reported, and that takes the total number of UK deaths to 62,033. Now, the Welsh First Minister has said that the new vaccine offers a glimmer of light at the end of a long and difficult year. But Mark Drakeford warned the country could face further tough restrictions in the new year. Wales now has the highest rates of coronavirus in the UK. And staff at a hospital in South Wales have told this programme they've run out of critical care beds, describing the situation there as desperate. Our Home Affairs correspondent Andy Davies is at Prince Charles Hospital in Merthyr. Andy.
Kathy, we too witnessed the optimism surrounding the vaccine rollout this morning, but the backdrop to this momentous day, certainly here in Wales, is really quite stark because infection rates have been rising for some time. The impact which the firebreak lockdown of last month has had feels like a distant memory, and it may be some time yet before we see what effect the latest restrictions on the hospitality industry may have. Restrictions, incidentally, which continue to be highly controversial. The reality is that in Wales as a whole, it has by far the highest 7-day rate per 100,000 of any nation in the UK at 326.8 per 100,000. And underpinning that, a strikingly high local rates. In 9 local authorities, the case rate is now above 400 per 100,000. And the worst of those is in Neath Port Talbot, where the rate is now more than 630 per 100,000. I've been speaking to the consultant who heads the intensive care unit here at the Prince Charles Hospital and a senior colleague of his. And they've said that the situation is now so bad that they don't have any critical care beds available at this hospital, nor for that matter at any other hospital in the local health board area. That's how serious the situation is. They're even operating at the level just below the emergency level. That's the just below the CritCon 4 level, where issues such as rationing of treatment potentially gets discussed. They're just below that level. And one of the big problems they've got right now in terms of looking after their regular patients and their COVID patients is finding enough staff to care for them.
At this moment in time, we've got one nurse looking after 2 patients, and even that's a stretch for us to deliver. We're trying to pull in staff from different areas to help us. We're out to agency all the time, but the agency staff aren't picking up the shifts, no matter how much money is offered. And
why not?
I think everybody's exhausted. Everybody's had enough of this. The mental exhaustion the staff are going through can't be underestimated. The staff need a break, and they can't have that, and they're not getting that.
How are you feeling right now?
I honestly feel that we've run out of ideas of where to go next.
How do you see the picture right now?
Desperate. We are desperate. Yeah. We've got a really good nursing team, but we're working way over our establishment figures and everyone is tired. We've got people doing overtime. All our shifts are out to agency, but unfortunately supply, demand, they just not meeting, and we're tired. We really are tired.
Are you saying that the patients aren't getting the level of nursing care that they should be?
They're getting the best care that we can give them at this time.
If the rates continue rising, what do you think?
We can't actually cope with any more admissions, I don't think, Dave, can we? No. Than what we've got now from all levels, really. I don't think we can expect a nurse to look after more than 2 level 3 patients. I mean, so yeah.
And for you professionally, how much of a worry is that?
It's a big worry. It's a big worry. It's a big responsibility.
My worry next is that the numbers in the community carry on coming into the hospital, that will carry on coming to intensive care, that the demand will carry on increasing and we just don't have the resources to deal with that. At that point, we'll move from being in CritCon 3B into CritCon 4, and CritCon 4 is the most extreme level, which is triage of treatment.
You're talking about rationing.
That is one of the parts of CritCon 4, that once you get to that level, it's rationing of treatment.
And how close do you think you are to that at the moment?
We're extremely close to that now. It wouldn't be a decision that we'd make at a local level. It would have to be coming from a national level to decide to declare CritCon 4. But we can't see a way out of this for us at the moment if the numbers are increasing as they are.
But aren't there extra surge intensive care beds around South Wales at the moment?
There are surge beds, but a bed without a nurse is completely pointless. I can only talk about where we are from the Prince Charles Hospital point of view. Our next step and what we're trying to do now is transfer patients to different hospitals within the network. The concern is those hospitals are going to be filling up as well.
What is your message to the Welsh Government at the moment?
My message is that we are in dire straits from the critical care side of things. We need to lock down again. The Christmas period is going to pour petrol on an already burning fire.
The 5 days is just going to be absolutely catastrophic for us.
The 5 days at Christmas?
Yeah.
You're worried about what impact that'll have?
When we're at the levels we're at now, 2 weeks down the line, we're not going to be able to cope with the increased pressure.
Andy, your report raises so many questions, really disturbing. What are the Welsh Government saying?
Well, it is disturbing. It's a cry for help, really, and echoing one that we heard yesterday in Swansea when another senior figure in the NHS said that they could be potentially looking at a potentially catastrophic situation if infections continue to rise. In response to the interview we did this afternoon, the Welsh Government issued a statement this evening. They said that they're aware that health boards across South Wales have been under immense pressure over the last few days, and they're working with them to relieve that pressure. We have daily discussions with all the health boards, they said, to help them, and we offer transfers or mutual aid where possible. The Welsh Government went on to say that they cannot control the spread of the virus alone and that the people of Wales have a key role to play in stopping the virus from spreading. And there you have it again, a plea from the Welsh Government to the public to play their part. But increasingly now there are questions as to what the Welsh Government should do exactly on this matter to help address what appears to be a rapidly deteriorating situation.